Hello. Today we're going to be hearing about a really important program to address diabetes in the Galilee, the northern part of the country. We have as our guest the expert on the program, Professor Naim Shehadeh, who is the director of the Galilee Diabetes Sphere Program. He's also a full professor of medicine at the Bar-Ilan University Faculty of Medicine and the president of the Israel Diabetes Association. Welcome, Professor Shehadeh.
Thank you, Bruce. I am happy to be with you in this interview.
We're so happy to have you with us. So please get us started. Just give us a little bit of background about this diabetes sphere program.
Actually, the real name of the program is the Russell Berrie Galilee Diabetes Sphere. And the sphere, it's an acronym for Social, Precision Medicine, Health Equity Research Endeavor. And was established in 2021 within the Bar-Ilan University Faculty of Medicine in Safed. And their main two goals of this project is to reduce diabetes disparities between the Galilee population and the general Israeli population, and to develop new models and best practices for diabetes care that are applicable to communities in the periphery worldwide.
That sounds terrific. Why the Galilee?
Exactly. This is a very important thing. I just want to share with you some numbers. The rate of diabetes in Israel, the average rate is about 10%, but in the Galilee, it is 12%. And also we have a parameter called diabetic patient with poor metabolic control. Poor metabolic control when they have HbA1c above 9%. It's a parameter for metabolic control in diabetic patient. And in Israel, the average is 9%. 9% of diabetic patients in Israel have poor diabetic control. And in the Galilee, we have 15% patient with poor control. And if you have poor control in diabetes, that means you have higher risks to develop diabetes complication, cardiovascular diseases, renal diseases, and also general mortality. So
that's very troubling. Why is it so much higher in the Galilee?
Yes, it is an important question. We think, and we have data to show that the occurrence of diabetes and the control of diabetes and also obesity is very much related to socioeconomic status. And if you have lower socioeconomic status, you have higher rates of diabetes and obesity. I believe this is the main cause for these high numbers in the Galilee.
Because in the Galilee, you have a lower income population?
Exactly. We have lower income population and lower socioeconomic status. I believe this is the main reason. And also, in the Galilee, we have different ethnic groups, and maybe also genetics play a role. So we can say that it is genetics and also the environment and the socioeconomic status.
I know that in the Galilee, we have a sizable Arab population and a sizable Jewish population. Is this issue as problematic in both the groups?
Yes, this is very important issue. As known in the Arab population, the diabetes rates are higher. And it's again goes back to genetics background and also environmental and also a social effect of social environment and socioeconomic status.
So what do you do to make it better?
Actually, we have a new project, and our intervention is, we take the city. We take the city as a unit of intervention. And in the city, we build what we call it a unique ecosystem of partnership. We collaborate with all the stakeholders in the city that can affect health of the population. So we are collaborating with HMOs, with Kupat Holim, we have Maccabi, Clalit, etc. We also collaborating with the Ministry of Health the Ministry of Education. We are collaborating with the hospitals in the area, and also, as I mentioned, with the organizations like the Israeli Diabetes Association, and also the academia. You know, this is the first time that academia, the Faculty of Medicine, is involved directly with the health and the control of diabetes in the community. No universities do this thing, and this is a very unique thing of the Faculty of Medicine in Bar-Ilan University.
So this is basically my last question or two. To what extent is there interest in your program from by people from other countries? And related question is that many of our viewers and listeners are from other countries. If they'd like to hear more, can they reach out to you? How would they do that?
Excellent. We already have some dialogue and some meeting with, for example, with Denmark. They have some areas some similarity with what happening in the Galilee area. We also have contacts with Canada, and also we have contacts in Arab countries in the Gulf area. So there some interest in other countries all over the world, and we always happy to discuss and share our program and our knowledge in this field.
That's great. And I was reading before our interview about the project a little bit, and I read about the tremendous, wonderful support you're getting from the Russell Berrie Foundation, and that one of the people there was saying that one of the reasons she understood this need was because her husband, Russell Berrie himself, had diabetes. And I'm just curious, what has drawn you to this project, but more importantly, to endocrinology in general?
Actually, diabetes is part of the endocrinological diseases. You know, the pancreas is an an endocrine gland. Its activity as an exocrine, but it's an endocrine gland. It has several hormones, and the most important hormone is the insulin. So it is related directly to endocrinology. Most diabetologists in the world are endocrinologists also. So this is why we are related to this, and also obesity. It's good to mention here that the major risk for developing diabetes is obesity. So these diseases goes together, and we are, trying to improve this, two diseases in the area of the Galilee. And we have several arms of intervention programs. First arm is prevention. We have a very good result in prevention. For example, there is a medical status called the prediabetes. The people who are not diabetic, but and not normal, they are, in the gray area. They are prediabetics. And prediabetes, there is a conversion rate. Each year, 8% of patients with prediabetes become diabetics. And it is known that if you can, intervene in this high-risk group by education, to change lifestyle, to do more physical activity and more healthy diet, and reduce weight, you can prevent or reduce the conversion rate. And this is one of our first programs that have shown that by intervention in different cities like Nazareth, like Nofa Galil, like Tzfat, Safad, and like other places, we reduced the conversion rate by 50%. By 50%. And
wow, that's amazing.
Yes.
It's amazing.
The cost effectiveness of this program is very good. And just you educate, and when you educate people for a healthy lifestyle, you not just prevent obesity and diabetes, you also contribute to better cardiovascular health and to reduce high blood pressure. So our program is really focused on diabetes and obesity, but it also has other effects on other important chronic diseases.
Professor Shehadeh, it's been a pleasure having you with us. I want to thank you for joining us and thank you for your work day after day in addressing diabetes and other endocrine issues in Israel. Thank you so much.
It's my pleasure. Thank you, Bruce.